Supervisor Hayes.
Good evening. First, I want to thank our Director of Human Services, Jerry, for all of the hard work she does for our county. I recognize the massive responsibilities she has, 250 employees in her department. And like our law enforcement, they deal with people mostly not having their best days. I also want to thank the many people who have reached out, and a very special thanks to the people who came and spoke at the public meeting and those who shared deeply personal stories. I've been able to understand better the perspective of people dealing with a mental health issue and also the family members who are just as much affected. I especially want to thank Fond du Lac Police Chief Aaron Goldstein. He was the first person I contacted when I heard of this closure proposal, and he and his staff have guided me on my journey to understand the depth of interconnectedness of mental health care with law enforcement and others in the community.
Can I pause you just for a moment? We've got a gentleman sitting in the front row with the sign. I'll allow the sign, but you have to sit in the back row and hold it so people don't even can see. I don't want you disrupting the meeting, so if you kindly move it to the back of the room, or I'm going to have to ask you to leave. So I'll ask you again one more time. Okay, sorry to interrupt everybody.
Okay. So I will go back to where I was talking about the depth of interconnectedness of mental health care with law enforcement and others in the community, such as the St. Catherine Drexel Shelter, Solution Center, the Warming Shelter, NAMI, ADVCAP, our schools, St. Agnes Hospital, businesses, civic organizations, and our faith community. I don't think there is an entity in our county that is not affected by the state of mental health in Fond du Lac County. After the closure was announced, there was a meeting with our county executive and our director of human services with the Fond du Lac County Law Enforcement Executive Association. This group is all the police chiefs in the county and our sheriff. They got lots of information at that meeting, and after that, they composed and wrote a letter to county board supervisors. They began by acknowledging the diligent work of the human services staff and the recognition of budget and staffing challenges. Here's a tiny bit of what they said in that letter, quote, "This is not simply a law enforcement issue. It is a healthcare system, public safety, and community well-being issue." They went on to say public safety and community health are shared responsibilities. Services like the acute are not isolated expenditures. They are investments in stability, prevention, and long-term cost avoidance. They said, "Our intent is not opposition, but partnership. We remain committed to working collaboratively with county leadership and community partners to identify sustainable solutions that support both fiscal responsibility and the needs of those we serve." So where did we go after this letter? I believe we are a part of county leadership. We had Jerry present to this board in April, and our board chair said that he wanted our committees to handle the issue instead of having an ad hoc committee. He mentioned adding public safety and finance to the two committees of jurisdiction. Did we get any collaboration? I think the answer is a big no. I could not get the issue on the Public Safety Committee agenda for discussion with the Fond du Lac Police Department, in spite of the fact that this resolution was going to come to that committee. Our Fond du Lac Police Chief personally attended all of the meetings where the resolution was on the agenda, and he spoke during the public comments part of the meetings, which means we gave him 3 minutes. What did he get? No discussion, that's for sure. Is that how we collaborate? At this moment, I want to recognize the Human Services Board and the Health and Human Development Committees and their chair, Supervisor Fenrick. After I was turned down by the Public Safety Committee, Chair Fenrick did put discussion with the Fond du Lac Police Department on the Human Services Board agenda. I do not doubt that the discussion they had led all 5 of the citizen members of the Human Services Board to say they were not in favor of closure with the information so far and without law enforcement collaboration. And the Health and Human Development Committee did not even bring the closure resolution to the floor for consideration. They are the committees of jurisdiction. They have had the most information and the most discussion. After finance last week, I emailed all of the police chiefs who signed that letter. And I wrote this to them. Over the past 2 weeks, Chief Goldstein has stood in front of 2 county board committees during the public comment time, 3 minutes, and asked that the closure be paused and that law enforcement leaders of our county be involved in planning what the future looks like. He has said the ask is not to necessarily to stop a possible closure. Everyone agrees changes need to be made, but to create a comprehensive, operational, sound plan involving all the community stakeholders for the full continuum of mental health services in place for Fond du Lac County. I would like to know your opinion on the closure. Do you agree with Chief Goldstein? I got 2 written responses, and I spoke on the phone with Chief Burgos of North Fond du Lac. They all echoed what Chief Goldstein had said publicly. Chief Bill Wallner of Ripon said, quote, I agree with Chief Goldstein's assessment and those of my fellow law enforcement leaders in the county that one of the major concerns is a lack of a comprehensive plan moving forward should the closure be completed. We have heard of various suggestions or possibilities as to how things may be handled going forward should closure occur, but the lack of a solid plan and stakeholder input is a serious concern. A comprehensive overall plan on closure, how that will be handled, and the plan moving forward should be, in my opinion, an inclusive conversation plan, not piecemealed into stages. This is from Chief Jeremy Roche of Waupun. I have a similar opinion to Chief Goldstein, as I believe a sound comprehensive plan will help law enforcement adjust to any possible changes in the future. I understand that there's talk of hiring additional mobile crisis workers and possibly a transport company to help with emergency detentions. But in my opinion, this should all be set to go prior to shutting the facility down. I don't think everybody understands all of the little details. I've heard many members of this board say we have to listen to our expert, Jerry, and I understand that sentiment. We have highly knowledgeable and competent people working for our county. I also see our law enforcement community as experts and highly competent. The Fond du Lac Police Department has been accredited since 2019. Only 10% of departments in the state reach that standard. We are shoving our social ills onto our law enforcement community. Everything our society creates, they have to deal with. Who is there when people have a mental health crisis? Our police and deputies. Who is there when there's a suicide? Our police and deputies. Who is there when someone is drunk and out of control driving a car recklessly down the highway? Our police and deputies. This is what Tom Weber, the jail consultant, said to us just last month. Quote, if you over-rely on the jail for different social problems or for your response to crime, which you are doing in Fond du Lac right now, then the jail is going to be the only solution that you pursue. I think you can all agree that's not a great setting to try to do a lot of meaningful intervention and change with those who have serious mental health issues. But in fact, a very large percentage of your inmates are afflicted with acute and subacute mental illness, and community resources are not always available for those. So the jail becomes the holding spot for those, unquote. So that really gets us to what this comes down to. Where and how do we allocate limited resources? And for us, that means money. We are hoping that closing the acute will save money. Jerry was asked by Greg Stensland, does the closing necessarily save the county money? Her answer was no, at least not initially. The theory is, with more robust crisis and community-based services, that you will reduce hospitalizations, but that's a theory. We have to face the fact that we are allocating less to human services. The closing recommendation comes because of budget limitations put on the Human Services Department, and they are not unique. All our departments have to work within an allocated budget. I marvel at how Tom Yonke manages when he gets the same levy amount every single year, no increase. We have heard that $8 million had to be cut for the 2026 budget, and we are holding many decisions in limbo because of the jail project. The fiscal constraints lead to all kinds of other issues. No doubt the inability to fill critical positions. Yet we chose to raise the pay of our deputies, so we pay above neighboring counties. The constraints are not the same across departments. If we look at the trend for our spending on human services, it is going down. If we look at the trend for public safety, it's going up. We are relying on theory to make this move with the acute unit. I think Tom Weber was telling us about another theory, that is providing comprehensive, accessible, on-demand, proactive mental health services will lower the number of people we put in jail and the high costs associated with that. Again, long-term cost avoidance. We have a choice. It's a policy decision. It is one that we alone make as elected county leaders. We need to pause this closure and establish a comprehensive plan. That plan needs to be collaborative, open to the public, and operationally sound. We need a careful and deliberate transition built on partnership. We need to back the blue. At this time, I want to make a motion to refer this resolution back to the Health and Human Development Committee to have them address the need for a written proposal that involves stakeholder collaboration.